Hi, welcome to the Counselling 101 segment where I share all key concepts of counselling and therapy that you'll ever need to know. Alright, so today we're going to be talking about the psychodynamic approach or modality and everything that you need to know about it as a therapist, as an upcoming therapist, and as a client to a therapist. So a little bit of history about it is that the psychodynamic approach falls under the psychoanalytic or psychoanalysis movement, which is a movement which focuses on the subconscious and bringing it into consciousness. It was brought into popularity around the 1890s when Sigmund Freud was doing his work on it and using it on his clients and writing papers on it and writing various books on it. So you may have heard of some of the techniques that are used in psychoanalytic therapy. So that's like the Rorschach ink blot test, free association, dream analysis, and so on. Those are some of the things you might have heard of, and if you've heard of them, they are referring to psychodynamic therapy. This type of therapy heavily focuses on the subconscious and our unconscious, and it believes that we all have conscious and subconscious thoughts which manifest in our behaviors and the things that we do. And this manifests in different ways, such as slip of the tongue, certain body languages, or certain things that we repeat over and over again without even realizing. And the whole point of this therapy is to bring those things that are hidden or forgotten or suppressed back into consciousness so that we can actually be aware of them and then make the effort to change them now that we're aware of them. Some of the common things that you might have heard of are defense mechanisms, which comes from psychotherapy. Projection, repression, and denial are some of the most popular ones. So the way it works in therapy is that once you're in the therapy room, there will be a lot of talk about, the past, your childhood, or previous memories, or things that you probably might say to yourself that you don't remember or that you've forgotten, but really they are there, just most likely they are in your subconscious. So for example, people who experience trauma, they will normally say, they don't remember or they can't remember, but really it's there. It's just that it's in their subconscious. And this kind of therapy helps a lot with bringing things that are somewhat forgotten or suppressed and bringing them back into consciousness. So unlike humanistic therapy, which I did a video on, which focuses on the present and also draws a little bit on from the past, this one more so focuses on the past and how it's affecting the present. So for example, someone might come to a therapist and say, you know what, I'm really, really stressed with work and I just feel burnt out and I can't stop working. I just feel like I have to keep working. And then next thing you know, you're discussing, and then it turns out that the reason you are so addicted to work or that you're a workaholic and you can't stop working is because as a child, your parents only ever gave you attention and love and support when you did good work in school or you did good work at home and you did your chores and you did something that you worked for. That's the only time you got recognition and love from your parents. So as a child, you internalize that subconsciously without even realizing that in order to gain love and acceptance and approval from people, I need to be a hard worker. And to this day, that's what you do. So that's just an example of what psychodynamic therapy might look like. So even though the issue is in the present, I can't stop working or I'm overworked and I'm burnt out, ultimately it goes back to something that might have happened in childhood or happened a few years ago that you might not even connect to what's happening in the present. And that's why I always make such a big deal out of go to therapy. Even if you don't have problems right now or any problems that you are having now, there's a good chance that they are related to something that happened in your childhood or something that you subconsciously learned and took in your childhood that you didn't even realize is now acting out, because a lot of the things you learned in childhood manifest later on in life when you're now in different relationships and different environments with different people. So once you go to therapy and you see a psychodynamic therapist, expect to be dissected, expect to be questioned, expect to think back a lot, expect to be brought back into your past a lot and to be asked very introspective questions that will really, really make you think, that will really make you question things, that will really make you look at things from a different perspective. So be expecting of that. So could you go to a psychodynamic therapist for anything and everything, or is it just for specific things? Well, to be honest, you probably could go to them for anything, but just know that there are obviously some things that are better suited to psychodynamic therapy, some things that are better suited to humanistic therapy, some things that are better suited to CBT therapy. So it just depends on your issue. But if you're not sure, you can always go to someone who's integrative, and I'll do a video on that in a few months when I am done with this year. So you can go to someone who's integrative, who has learned a bit about psychodynamic and other modalities that they can incorporate into therapy with you. But I'd say probably from my understanding, the best things to go to a psychodynamic therapist for would probably include things like trauma, PTSD, anxiety and depression, understanding your childhood, trying to fix reoccurring cycles and patterns in your life that you don't like, that you keep repeating, it would help a lot to understand where that came from and why. And I think also working through fears and phobias, because once you understand the root of things, it's a lot easier to then manage them or get rid of them or control them. So I hope that helps. And if you have not watched it, the other Counselling 101 video I did on humanistic therapy, be sure to watch that next. So I will see you guys in the next video. Bye.